In health news, COVID cases are surging again in America. The highest numbers in California, with Texas not far behind. Most of those cases now due to a new mutation. And our medical expert, Dr. David Winter, joins us live from his office at Baylor Scott & White. And when you see new strains and hear about spiking numbers, Dr. Winter, how serious is it? How concerned should we be?
Yeah, it looks like it may be more contagious than previous strains. A little early to say for sure. And I worry it may be more serious also because hospitalizations are going up more rapidly than I've seen in a year or so now. So I worry about that. Symptoms that you'll look for: runny nose, sore throat, cough, shortness of breath. The similar symptoms you see with a common cold, with influenza, with even sometimes allergies. So when people call me with those symptoms, I say, you got to do a test. And I've got a test kit here to show. Pretty easy. You can get these at the pharmacy. They don't cost very much. Here's a swab. You go up one side, the nose, go up the other side. Put it in this little tube here, twirl it around 10 times. Then you've got this little pad, you put a drop here, and in 10, 15 minutes, you have your answer. These tests are pretty reliable, Mark.
Okay, good to know that we have a way to test for it. But when it comes to getting this virus, is it still spread mostly through the air like we've seen in previous strains?
Yeah, that's the most common way it's spread. And in fact, I can tell you, in some counties in California, they're actually talking about putting masks back on people out there. That's the most common way it's spread. People are coughing and sneezing, stay away from them. But you can also get it from close touch: hugging, kissing, shaking somebody's hand, touching a doorknob when somebody had COVID, just touched it. So frequent hand washing is also important.
I know vaccinations are in the news recently, especially with changed recommendations from the CDC, and that raises concerns about, all right, how do you protect yourself from it? But let's say you do get it. How do you treat yourself?
Yeah, there's a really good medicine, Paxlovid. Some people call it Paxlovid. It's been around for a while. 3 pills twice a day for 5 days works really, really good. There's another pill that's available, long name, Molnupiravir. That works also. And if you get sick enough to go in the hospital, there's an IV medication, Veklury. So we have some medications to treat it. But the idea, as you mentioned, Mark, is not to get it in the first place.
Well, one of the ways you do that is get vaccinated. And I know there are a lot of questions for folks about how well the previous vaccinations work against this current strain and if those vaccines are even going to be widely available for everybody.
Yeah, the current vaccine does work very well for this. We already know that. And we've been told from studies that the new vaccine coming out shortly, that also will work. But the tricky part now is, can you get one? The leadership in the FDA has changed, and they're now saying that you get one if you're over 65 or younger than that and have some chronic illness. Well, that makes me worry. I think if that goes through and people don't get vaccines, we're going to see a whole lot more of COVID going around this year, Mark. I worry about that quite a bit.
Me too. I don't want to get it again, and I would be happily vaccinated. All right. Thank you, Dr. Winter, as always. Appreciate your time and your expertise.
Thank you.